Hello, sir. Good evening. Could you hear me? Dr. Ahmed? I'm Dr. Ramya. Could you hear me, doctor?
Assalamu alaikum. Yes, I hear you, doctor. Welcome.
Thank you. Thank you so much. Thank you so much, doctor. Thank you.
You are welcome. Welcome. Inshallah, few minutes. Inshallah, we will start at
Sure.
7:30.
Inshallah. Inshallah. I'll wait, doctor.
Inshallah.
I'll wait. Thank you
Okay.
so much. Thank
Now you are co-host. You can share and everything is
you.
okay.
Yeah, I
Inshallah.
will. Okay, I will share now right now. Thank you,
Okay.
doctor. Thank you.
Welcome. Welcome, doctor.
Hi, Dr. Amya. I'm Dr. Shakil Ahmed, and I'm with you right now. And at 7:30, I'll start introduction. And once
Yes, doctor.
then you can take start. Okay.
Okay, sure, sure, Dr. Shakil. Thank you so much. Glad to know you, both of you. Thank you so much.
Hello. Testing. Testing.
Yes, yes, yes. I hear you, Dr. Shakil. Dr. Shakil, you hear me?
Hi. Can you hear me?
Yes, yes.
Yes. Okay. Good. 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 I
Okay,
just
doctor.
confirm
Yeah,
you are
yeah. Thank
okay,
you
good.
so much.
Welcome. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Dr. Shakil Ahmed from Marcus Talim Electronic. Good evening, everyone. Today we have session about micro credentials in higher medical education. And this innovative session is going to present by Dr. Ramya Sanjeevi. She's basically a lecturer in physical therapy department at the College of Nursing and Health Sciences, Jazan University. She holds a master's degree in pediatric physical therapy and is a certified exercise physiologist to the American College of Sports Medicine with over 10 years of experience and in both theoretical and clinical courses in physical therapy. She has supervised students' graduation research and assisted in their publication efforts. So Ramya is an enthusiastic researcher in the field of physical therapy with notable publication in reputed journals. She has a good teaching experience, so she is here to present this innovative and informative session. Hasin Ibda and Dr. Ramya, please.
Good evening, everyone. Thank you, Dr. Shakil. Really, I'm excited to be a part of this forum. Thank you so much for selecting me. And I hope I can connect with the like-minded peoples and individuals and colleagues where they can share their knowledge and we can engage a meaningful discussion after this workshops. First, as a physical therapist, I'm glad to talk about this micro-credential. You all know about my name, it's Ramya. So at the end of my name, we can see an ACSMEP. That's a certification from the American College of Sports Medicine. So the title also having a link regarding this course. Let me introduce what is the need of microcredential in the present world. As a healthcare professional in the world, we need to update ourselves in each and every day in order to save the lives. And also, it's very important not only updating ourselves, we should have a quite good knowledge and skills and competencies in align with the labor market. Then only we can prove ourselves that we are in alignment with the present world. And of course, without a quality care, even patients cannot able to perform their regular activities. There are various forms of CPT. Of course, we all know whether we are from engineering or from arts and wherever it is, we have to develop ourselves professionally. And the main important goal as a physical therapist and a healthcare professional, we have to update ourselves on each and every update because this having a impact in the present scenario, and also in order to make ourselves pioneer, we need to be improve our developments. We all know we have some courses, we have some extra workshops, seminars, even example today's forum. This is also one of the way we are improving ourselves as a professional. But how we can able to specialize ourselves in a specific topic? For example, how we can say, if you want to be a specialist in some diabetes example, because the world is full of diabetic population and heart diseases, how you can specialize yourself in regard to the present scenario. So this can be done by creating a micro-credentials by renowned institutions, especially by institutions, not a private company like some other corporates. It's purely by an institution who can be able to improve the skills of the professionals after the year, especially after the year undergraduate or masters. And why the importance of pandemic is in coordinates with this micro-credentials. After the pandemic, we could see that the whole world is in upside down. And it is the very, that is the realization we had on the time of COVID, the importance of e-learning. We had a time to think ourselves, what we did in the past, how to improve ourselves professionally, what are the interests we had. So there is a time actually that is really the pandemic time So we can able to do some extra things to improve our profession and to improve the complete health care, which is absolutely improving the medical field. That is the direct way to reduce the economic cost of the burden of healthcare. So let us see what is micro credentials. This is the definition given by the European approach to microcredential. Okay, European Commission, especially OECD. So from this definition, it's very important to note three important points. First, it is the record of learning outcomes. Of course, we all teachers, we know what is the importance of course learning outcomes, CLOs. The same thing comes here as a micro credential. It's like a course, or it's like a batch, or it's like a module. So it's a record of learning outcomes that a learner has acquired from a small volume of learning. It's not about bachelor's, it's not about master degree, it's just a small volume from the in specific to one topic. Example, as I said, diabetes management or specialist in hypertension management, like that. So what is the importance of these learning outcomes? These learning outcomes needs to be assessed. Assessment should be very much transparent, and it should be clearly defined the standards. What are the aims we are doing assessment for? What is the further standards of improvements we can able to achieve? So here itself the quality comes. The second important one is it's about the specific knowledge, skills, and competences that respond to societal, personal, cultural, or labor market needs. This is the very most important in the present world. In Saudi Arabia, we are producing the students, that means our kids, to match with the labor market. So even though they're completing their baccalaureate's master's degree, we are in the present position to improve them in some of the labor market. Example, in healthcare, coming to the Ministry of Health or fitness departments or even sports department. So there is some special unique skills they are needed for the individual labor need. Then the third one, the micro-credentials are owned by the learner. What's the meaning of owned? It's completely, purely by the learner's input. No, from the teachers, no. We cannot force them as like in the bachelor degree, not like that. It is purely owned by the learner, which can be shared. Shared means especially in the social medias like LinkedIn. Yes, we can have some batches or like that. We can able to share it, and which can be portable. Portable in the sense of we can able to verify their micro credentials internationally. Even if you complete a course, even in Australia or America, they can able to verify it. Is it really credible? Is it really having good quality? Or these people, these learners are really worth for their labor? So it needs to be having all these criterias, and they may be stand alone or it can be combined into larger credentials. Larger credentials meet like our national qualification framework, level 6, level 7, or like, master degrees. So we can also, it's like an add upon. Even, there is an example in engineering, especially in the Google. In the course that they're having now, they are not asking to complete some bachelor in engineering. Even they're completing a courses, they are giving some examples. If they complete a course for 6 months of duration, they're giving a job, they're getting a job in Google. They are not asking for any bachelor degree or master degree. See, this is the value of a micro credential, where they can easily get the jobs in the labor market. They are underpinned by quality assurance. Without quality, nothing in the world. Nothing. Even if we want to purchase a simple dress, we are going to get from the proper high quality shop. Of course, the quality, what about the learning? That's the life. So, of course, this micro-credential also should have a perfect quality assurance that needs to be followed, the agreed standards in relevant to the sector or the area of activity. So now you may have the idea, doubt, what is this? How we can able to check for the labor needs? As a lecturer, As a faculty, we are responsible for our students' labor. It's one of the KPI, of course. So how we can check it out? We have to communicate with the employees. What is the person need? What the person state of patients they are coming on. Actually, if you see in the medical area after the COVID-19 pandemic, there is more influx of cardiac patients. Even if you see any of the tertiary hospitals, we could able to see many cardiac patients. Stroke patients are nowadays increasing. So we are having a mega credential which is really having a skills in specific to cardiac conditions, cardiac rehabilitation or exercise physiology, like that. So we are all the one who can completely gaining the value of the department along with our baccalaureate degree. So I hope you know what is the meaning of mega credential, you know that. Then, so it's really, very interesting. What's mega? This very new term. Who developed it? Why they developed it? The one who developed is European Skills Agenda. They are the first one, European, at the in the year of 2020. See, there is a connection between the COVID-19 and 2020. Of course, it's a pandemic. That is the time they just started to discussing about this mega credential as a term, especially in the OECD, that is the main international organization to check about the overall economic cooperation development. Okay, so they are trying to rule out how to get the good learners or the good people to for the labor market develop. So they aims to develop increasingly better applied skills among workers within the European labor market. Actually, at 2020, they started in Europe. Simultaneously, in Australia, in America, even in UK and Canada, they are started this. Presently, it's going on. It's going on many universities. Even Alhamdulillah, in Saudi Arabia also, we are having a platform. It's called Microcredentials, where they are excellently executing this with the proper initiative of the Human Capability Program. So what are the aim to develop this MC? First, of course, empower people to acquire the knowledge, skills, and competences. They need to thrive in a changing labor market and society. It depends upon the country. So what are the important changes we have to note? In the coming to the medical department, as I said before, the COVID-19, all different scenario, we have many lifestyle diseases. So there is some focus needs to be transferred in order to empower the people, okay, to help the society to come up in the best position. And second aim is to focus on preparedness of providers of MCs to enhance the flexibility of the learning offer. MCs here mentioned as micro credentials. So we are preparing the providers more institutions, how to enhance the students' capability as per the labor market. Third one, to promote the inclusiveness and equal opportunities, contributing to the achievement of resilience, social fairness, and prosperity for all. The last word is enough for us, I guess. Prosperity. We all want to be a prosper, right? We all. If you are prosper with the family, of course, society will be improved. Society is a good prosperity. What about the country? Simultaneously, the country would be the one who will be an example or model for other countries. So that's the main aim, to enhance or implement these kind of micro-credentials in your own programs. Actually, we all know there are some certificate courses, there are some license exams. Yes, we all know, we all have. For engineers, they have license. We are as a medical professional in Saudi Arabia, I want to give some examples. It is SCFHS, Saudi Commission for Health Professionals. So we are having a license exams. So which is the proof we can ourselves that we are a qualified, registered practitioner in the field of physical therapy or a nurse or a nutrition department. It's different, right? Medical practitioners. So this can also be one of the form that was previously means before it, even now it is going on. Even though they are saying any of these forms as a nano degree, if you check into the some Coursera, I hope you all know about Coursera like that. It is from the Google. We can able to see there are some degrees just giving some credentials to have some certification like. Then micro masters, Credentials means like we are adding some of the points to meet in our license, or like it's like a values. Then certificate programs means, even for example, we have some value added courses for even in our department we have some value added courses for the cardiac rehabilitation. So these are like, various forms of micro credentials which needs to be established in exponential manner by every program in order to support the society. Batches are examples. You can see, if you're quite good in the LinkedIn, you can see some batches from the people in their profile, which shows like, a accredited professional in this registry, like that. They have some batches, intermediate or some professional, advanced, like that. So this can also be one of the form where the MC can be diversified. So what are the criteria? So we all know that there are many forms, right? So how we classify this form, various forms of macro credentials? First, depending upon the duration of macro credential, how many hours, how many weeks, how many months, or how many years. It's depending upon the duration of macro credentials. Second, awarding type. Awarding type mainly, it's depending upon who is awarding, within the program or by the institution with the proper quality assurance check, or by the national level accreditation, or by the overall impact of the labor, especially the employee. Some employee also having a crash courses. Even Google, they're having a crash courses, right? So we have to know that who is giving this course, what is the real validity of the course, and what is the duration, all needs to be considered. So according to these criteria, first goes to the skill credentials first, which is a very short course, very, very short, just for, hours, just skill credentials. Second one could be the modules. Modules can be like 100 hours of contact, like that. Then third could be a short formal learning programs, which can be like an extended period of time for around 3 months or 4 months, like that. So once they complete this 3 or 4 months of learning duration only, they can able to pass, or they can achieve the required amount of credits. So these are the three forms of the three groups of credentials. First goes to skill credentials. See, this is about 4 to 12 hours of learning hours. This is non-formal learning. Example, in our medical, we are having some first aid course, like example I'm saying. Okay, we have to update ourselves to make this to be done as a professional in the healthcare. So it's a skill based value added course. It's mandatory if you want to get the Saudi Commission for Health Professions example. Then these are no need to be accredited by an external quality assurance bodies. This can be done by the Saudi Cardiac Association. So there is no need to check. But actually, Alhamdulillah, they are having a quite good reputation along with the European councils. So, for this, I'm giving an example. But what is the important thing you have to notice? There is no need to be a extraordinary quality assurance checkups. The third main goal, then why we have to use that? To acquire specific skills. That's it. Actually, for example, we are giving some mobilization. For example, I'm talking about from healthcare. We are giving some crash course for 10 hours. They can come, they can have a course for the whole day, and which can be assessed by them at the end of the evening session about some questions of MCQs. Then we'll ask them to perform some techniques, how to do the techniques of manpower mobilization. Then we'll give them some certificates, which is really adding advantage for them to get enter into the labor market. And this will be one of the added skills in their profile. Second form is a modules. It's a longer than the skill credentials. It's longer than the first one. They take between 25 and 150 learning hours. So it takes some time. It's not easy for 1 day, 2 day program to complete. And these modules are having a more validity when compared to skill credentials. Why so? Because it's accredited by external quality assurance bodies. What they will see, they'll check about the learning outcomes, our assessment methodologies, our course reports, how we are performing, all will be assessed. Of course, this will be a quite valid, and these modules are already started by our university along with the MicroX. So this is a web page of this MicroX. As I said before, it's from our Saudi Arabia. It's an initiative in order to empower the human capability program. It's a sample of course I want to show you. See, the course name is The Art of Management Consulting. It's a general topic. It's general topic. It's for all professionals who wants to open some entrepreneurship or some clinics or some things. So we can able to get some idea about the management. So see in the right side of the slide, you can see the program details. It's a purely synchronous online learning. 500 people can start this, 500 seats. See, program duration 20 weeks. And what's the actual hours? 53 actual hours. That's why I want to say that modules needs to be having more credentials, more learning hours. It comes here. This is a sample of example only. So example, why I'm showing this micro access, because it's from our own country, Saudi Arabia. We need to do this. We can spread the word to our students, how they can improve themselves. And it's very clearly explained all these, the things, how they have to pay. This is purely with the payment, or 500 riyals, 300 riyals, because they have to pay, then they have to study by themselves, they have to appear for the exams. The exams can be an online VAU, like that Pearson exam institution or that. So it's depend upon the site or depend upon where you are studying this course. Then the third one is about short formal learning program. It's a program. It's a program. It's not a module. It includes options for assessment, which vary from 150 to 1,500 learning hours. Their quality is always explicitly evaluated by external quality assurance body. Same as like module, but this is much more detailed. The goals of short learning programs are linked to specific career professional goals depending upon the career. For example, if I say I am a short formal learning program completer because I completed my credential from the America, it's about the exercise physiology. Even though we are having a quite good knowledge of exercise physiology, my complete course is about how we can prescribe exercises in specific to non-communicable diseases, example like diabetes, hypertension, obesity. So this is a quite good way how we can focus our interest and we can dedicate ourselves to complete this kind of credential, and which is really useful for the market as well for the development of the country. That's the first and the last goal is that is the one only one thing. Then, so we know the introduction, what to do, and what are the forms, right? So let us have a, just a brush up. How to design an MC? Since we are faculty, we want to improve ourselves. We want to improve our students. We want to improve our program. Of course, yes. And we are having quite potential to do our own credentials depending upon the program. So we all are needed to focus in which part or which area in specific to your program to design and micro-credential. Actually, this can be discussed in another workshop. Like, but I want to give you some short principles how to start a micro-credential. And according to the European approach to the micro-credential, because I'm taking European are the one who initiated, who consequently following the quality appraisals, who is communicating along with other countries in order to focus on the labor market. So that's why I'm taking them as a KPI to in order to make you sure that we are getting this idea only from authenticated professionals, not just like that. Okay. So it's about 10 principles, 10 principles. These are the characteristics if you want to generate or if you want to create a credential under your program. And these principles are universal, universal. So that's why if you're trying to do a credential or designing a credential, we should know ourselves that is it real valid? Will they accept if it is going to some Western countries or even to the Eastern countries? How we can make ourselves, the excellent credential program. And one and only main motto is it should be in alignment with the labor market. That's it. That's it. One thing, labor market. So very colorful principles. Quality is the first principle. First is the quality. Second is the transparency. Without transparency, nothing will be achieved. Relevant to the society and also the labor. And assessment should be very much valid. And what about the learning pathways? Of course, we need to be very much clear where they are starting, where they are completing, if there is a possibility to improve ourselves in the further years. Recognition from which institution or which body is giving this EMC, portability, how they can able to manage this kind of EMC, which can be valid one, which can be checked all over the world. Learner centered, it's all whether it is an undergraduate or a PG or a MC, it's very important is learner centered. They have to, it should be very easy for them. Authentic, without authentication there is no quality. And information and guidance, these are the 10 principles we have to inculcate in the means of credentials. First is quality. Quality, we all know that we have a quality department in every department, in every program we have quality coordinators. So why this quality is coming here? It's a subject to internal and external quality assurance by system producing them. What is the meaning of internal external quality assurance? Internal quality assurance means for example, we are doing some my midterm exams, right? We are doing midterm exams. We are analyzing our midterm exam results after completing our midterm exams. What about the discrimination index? What about the difficulty index? How the students performed, which is a real difficult one, where we have to change like that. That is internal quality assurance. What is the meaning of external? Once completing the course, once completing the credential, we are checking their performance retrospectively, how they performed, how there is an improvement. Is there any weakness? How we can improve it? Do we need to change any learning outcomes, or do we need to improve our strategies to improve their learners' capability? We have to check along with the labor, especially the employees, are they really efficient as per their needs? It might be fit to the purpose and it should be documented. Without documentation, there is no quality. All quality needs to be documented in a perfect manner, which can be accessible retrospectively or prospectively, and meet the needs of learners and stakeholders. That's the only aim. Transparency. We all should be transparent. It should be measurable. The MC should be measurable, comparable, and understandable with clear information on learning outcomes, workload, content, level of learning, learning offer, which are relevant to each other. So what is the real importance here? We cannot give a MC, for example, a module or fitting is out of the context. So, example, if you're giving a simple MC, it should be measurable. Measurable in the sense of where they can take the assessments initially, pre and post, which needs to be comparable. Is there any improvement in their skills and outcomes, on how these skills are highly impactable with the labor? So, all these needs to be coming into the learning outcomes. Relevance, how it is relevant, it should be a specific learning achievement to address the learning needs. This is really, it should be noted relevant. It should be relevant to the present need of the society or labor market. And cooperation should be needed between the organization, employer, social partner, even some other providers like Google or some Microsoft, like we can. Yes, we can in future. Even Microx, it's one of the provider from the government. So if you are planning for this, we have to have a quite good cooperation. There should be proper feedback, and these needs to be taken into consideration. The program coordinator needs to take all this consideration, and they have to properly check how they are performing. Then assessment, we all know how to assess a course learning outcomes, especially in the means of a transparent standards. Every course learning outcome is very important, very important to check the students' capability. Without course learning outcome, we cannot able to assess the students' performance. Students' performance in the sense skills, knowledge, and competency as well, all together. So it should be a valid assessment. It needs to be accepted to the whole world. And the learning pathways should be flexible. One and only thing in learning pathway is flexible. What is the meaning of flexible? Because they are learning this from their own time. They are not coming to college. They are not coming to some of the institution to complete this credentials, their own interest. And who will do this? Mostly the master degree because we have a study research from the Australia and Canada actually. They search that who are all the one really interested in microcredentials. The one really interested in microcredentials are the one who completed their masters at the people who having experience of more than 5 years completing their bachelor degree. They are the one who wants to improve their professional, who wants to go towards their interest. They are the one who is checking for this microcredential. So that's why it should be flexible. They can take their own time, they can extend their time, and it should be stackable. Stackability means it should be as per the modular way. What is the meaning of modular way? Which needs to be a proper blocks of learning outcomes. They can once complete it, they can able to cumulatively get the ideology. That is the stakeability. Validate, that is the thing. We are starting from the quality. It's a learning outcomes. If you set up proper learning outcomes, automatically these credentials will be recognized overall across different systems. The recognition, the one and only thing is signaling value. This is the hard to take home message. If we are generating, if we are creating an MC for our program, for our labor market, this is a signaling value for the learners. This will be quite another milestone for our university or the institution to check about the people capability to work in labor market. Okay, it's based on standardized procedures for assessing the foreign qualifications, especially those issued by the accredited educational institutions. Yes, we all willing to study from Oxford, excuse me, MIT. Yes, no, why? Because it's highly recognized, highly accredited, they're up to date in their researches, and they are the present one who's talking about the complete present status. Of course, we have to get these from the recognition, mainly from the accredited education institution, example, our university. Portability. I'm giving some examples of University of Durham, but this is the batches they are giving us. Even in the they'll send you. We have in the LinkedIn, they have their page. We can able to get we can link it to them. These pages will provided in an electronic manner, so they can have this as a badge in the LinkedIn pages because it's a big quite good media. That means a site where they can able to get the labor. That means they can reach the employees, no? So these are owned by the credential holder and may be stored and shared easily by the credential holder, which including through the secure digital wallets. For example, in my category, I have a number and I have a batch, and see they are asking me for my recognition. So what I do is just I'm sending the batch along with the number. They will check which can be accessible by the proper organization. Once they check in, enter my numbers, they can get complete idea, all the details, what I studied, what are the important skills I performed well, what are the best competencies when compared to other of my colleagues. So it will show off the complete ideology, complete history of my course. So these needs to be very easy. Even I can apply for Australia or even for any place in the world, which needs to be properly shared and stored with a confidential manner, and also it's properly owned by the learner. It's a learner centered, always a learner centered. Then only it can be a good module to meet the needs of the target group of learners. Learners are involved in the internal and external quality assurance processes, and their feedback is taken into an account as part of the continuous improvement of the credential. What is the meaning of learner center? Learner center means we have to focus on what is the needs for a learner, and also we have to match with the labor market. And all these categories needs to be having a improvement every 6 months or 1 year once to update ourselves depending upon the needs of the labor market. Authenticity, it should contain a sufficient information to check the identity of credential holder, the legal identity of the issuer, the date and location of the issuance of the credential. Every certificate and every MC is showing all these data, the date of issuance, the location where they issued, and for how many years this is valid, and also how you can check their skills in the registry. So this I have to insist here. This my credential needs to be updated, and they have to get some gain data also, like credit hours, which needs to be added as a points in order to renewal to get the renewal of the mega credential. Some MCs no need, but some MCs which need to be, the for example, in my side in healthcare, we have to be example in the cardiac rehabilitation. There are having many MCs. But these MCs are valid only for just 3 years or 2 years, and we have to be continuously developing our professional improvements by learning some points, how we can get these points by attending some workshops in the same platform, by attending some conferences, or by engaging ourselves with some webinars. All these are the one where we can able to improve our skills, and after that they're asking some questions as well, like quizzes, and how we learn that. So it's properly double checked and cross checked by the program, by the MC. Are they really attentive to us? Are they really got some ideas? So they valid all these things, and then only they can add it to our credits, and this will be renewable. If you are not for any interest in this MC till life, and this cannot be renewable, that is the authenticity. Information and guidance. It's a lifelong learning guidance service. Once, yes, as a faculty, what we do, even our student is asking us help after 10 years, we do the same thing. The same thing is here, microdential. We dedicate ourselves as a teacher. That's a very important thing. So we have to guide them for lifelong. How we can guide them for lifelong? Properly cooperating with the labor markets and with the learners, and modifying and changing the modules as per the needs. And it should reach the broadest possible learner groups. Don't focus only to one part or like that. It should be needs to a learner possible broadest, because it's education. Its education can change the whole world. The simple thing. And supporting the education, training, and the career choices. Last but not the least, my credentialing in employment, how it is doing. I hope you all know about the World Economic Forum. It is completely running in Switzerland. It's basically, from all the organizations, especially government organizations, who is having a frequent assessment, frequent checkups, right? So they are the one who is giving this ideology. The World Economic Forum Future of Jobs reports that from the year of 2024 and 27, approximately 61% of workers need retraining. What is that retraining? Why we have to retrain them? Because they completed their bachelor's, completed their master's. Why we have to retrain? Yes, we have to retrain. It's an era of digitalization. It's an era of pandemic. It's an era of work-life pressure, lifestyle diseases. It's all. Our world is completely, even though we have many positive sides, as a healthcare professional, I could see the negative sides as well because of digitalization. It's really true. I think it may rise also. They need retraining, even you, even me. We need to update ourselves. Then only we can update our students. Then only we can able to get the EMCs. Updation. Updation is the one and only logo motto for our well-being ikigai as like. That is the one thing we can able to give the best thing to the world. Skill-based hiring and MCs can be effective educational responses to address the skills, talent shortages quickly at scale. This is the fact. This is the fact. This is a proven in many of the researches which has been done for the past 3 years. And these are all proven that skill-based training is very much important. And these people are getting hired by the labor market, and which is really importantly helpful to give a good productivity. Currently, employers are hiring according to the skill-based strategy. Of course, it's not like before. Now they all skill-based. If you check in the IT profession, they are having asking some important like certification. Yes, even in the medical field also, they are asking us if you want to excel in one specific field, like I can say it as an cancer education, cancer rehabilitation, cancer management. Cancer is also increasing more nowadays. So all these updation all can be achieved by a course. Of course, we are improving our courses individually in our bachelor and master degree. These are added skills depending upon the labor market. And the MCs not only confirm the skills and competencies learned, but also demonstrate positive attitude towards learning and personal developmental needs. Yes, how do you feel if you're completing a course and with excellently you can gain some idea, just really giving some good education, good counseling to the patient where they're aging the lifestyle. These are all really matters for our self growth. So, what is the importance of promotion as a faculty? As a faculty, and also we need promotion, right? We need promotion. Even I'm a lecturer, I raise my standards to meet up with American counterpart. What about you guys? Yes, we have to. Then what about our students? They also deserve, they all really deserve from us to create or generate some MCs in matters to the labor market. And for us also, we have to check our own self-growth. Where is our interest? Which MC is available in the world where we can get an authenticated, a qualified MC which can able to increase our values and standards. Personally, I'm saying, and also which can be useful for our promotions. Not but not the least, this is the first and foremost thing. Thankful to the European approach to microcredential, who really, ignited this ideology in 2020. This is complete thank because all these data are retired from their website, and it is really, I can share this with you. You can also check it out. It's excellently given. These are all the references from where I took all these stuffs in order to explain this to you. Really, thanks a lot for giving this opportunity to me. Thank you so much, Design University. It's my pleasure to give this. Yes, it's a question and session. I would glad to hear from my peer.
Thank you so much, Dr. Raima.
Thank you, sir, doctor.
Thank you so much. And now I will open the mics for all the participants. If they want to
Yes,
share by questions, by anything, I will open for all.
yes, sir, yes, sir, yes. Thank you.
Now anyone can open the mic and unmute himself to ask any question he need, or by contacting by chatting or Q&A. For the certifications, I put in the chatting now a link. You can fill the questionnaire, and the certificate will be in your email, inshallah. Okay, doctor, thank you so much. If we don't have any questions, we can end the session. Thank you for all the participants for hearing and concentrating. Thank you, Dr. Ramya. Thank you for all.
Thank you.
Thank you so
Thank you,
much.
doctor. Thank you. Thank you so much. Thank you, doctor.